those.
Great, yeah. Yeah, and I just want to welcome everybody. Julie organizes these sessions for us, and I'm thrilled to be here as the director of the center. And we have Dr. Shelley Cobbett and Professor Nadine Ezzeddine. And we're just going to turn it over to you. We're thrilled that you'll be sharing your wisdom with us.
Thank you very much, Megan, and thanks to Julie for setting this up. And Nadine and I are both excited to talk about the provincial research that we're involved in. This is the very first presentation, and so I will let folks know it is preliminary. We do have additional findings. We actually are meeting again at 2:30 today with the team to continue on quality analysis. So we thought we'd present the overview of the study. I'll present the quantitative data, Nadine will present the qualitative data, and then we'll just open it up for questions if that's okay. All right, so the name of our study, Faculty and Student Online Learning and Teaching Amidst the COVID-19 Pandemic Report. No, I won't. Sorry, I'm just trying to get this. There we go. We were set up really good to do this research because we have a long-standing collaborative relationship with the two other universities in Nova Scotia that teach nursing. Since spring of 2014, we met at least twice a year, most times 4 times a year. And in those meetings, we really look at provincial curriculums and how we can enhance programs. So we had the basis for that sharing set up. So today we'll talk about our methodology. We'll look at the results and then any questions. And we thought this picture was quite telling because it's really a picture of what university classrooms look like globally right now, and that's empty. The research team is made up of Dalhousie, Cape Breton, and St. Francis Xavier universities. So Nadine and I are both on from Dalhousie, Walina Nemeth and Debbie Brenwick from CBU, and Patty Ketchin-Handsome, the director at St. Yvette. Our purpose was to gather student and faculty experience of how we rapidly shift overnight really to fully online teaching. At a time we had students in clinical practice, we had students in clinical integration, as well as a full course load on site. We used a descriptive survey design and ethical approval was obtained at all 3 universities. So our questions were, and what we'll present today is really the first results of the first one. What was the experience like for students and faculty when we did this shift? And also we wanted to see if there was a relationship between the student perception and the faculty perception of effectiveness of teaching and learning, student engagement, and the comfort in the online teaching and learning experience. And some of those we'll be able to speak to today as well. We had 2 instruments which we developed just for use in the study, the student online learning and the faculty online learning. And there were several parallel questions so that we were able to look at the differences in faculty and students. And it was interesting because we asked faculty what they thought of how students perceived, or we asked faculty what they thought students viewed as the most engaging, most effective learning tools online, and then compared. So we'll look at some of those differences. Some are quite stark. We had Opinio survey used, SPSS, NEBIO, and we followed Braun and Clark's thematic analysis steps. So for the faculty, we had an excellent response rate. There were 51 faculty in Nova Scotia, and those were faculty that taught undergraduate nursing students. So any faculty that did not teach undergraduate students is not included in this study. 30 participants completed all aspects of the survey, 45% from Dal, 21 from St. Yvette's, and 13% from CBU. The student picture we're going to present today came from 195 students, 31% response rate, but we did feel it was a good response rate. We had a lot of students that were invited that were in term or semester 8 of our program, which means they were in clinical practice and often weren't responding. The faculty data, and this really reflects the demographic of faculty across our country. Approximately half of the sample had greater than 15 years experience in post-secondary education. What was interesting here was only 3% of the sample had taught less than 1 year. And you know, when we were looking at the data, I can't imagine last year being my very first year in academia and teaching. it must have been a very isolating experience for new faculty members. So again, something to keep in mind as we're providing faculty peer-to-peer faculty support. Almost half were in rural Nova Scotia. Just over half had dependents living with them. And we asked students that question as well, because we do see the challenges. Even some of our popular media shows on TV saw some challenges with kids running in the background, and just moving the whole environment and opening really our homes to students and colleagues. About half pre-pandemic taught fully online courses. So we did have about half of the sample that had never taught a course fully online. With our summer semester, we asked them what they actually did. What were the requirements? 40% had asynchronous with optional synchronous opportunities. 33% asynchronous with mandatory synchronous requirements. 23%, or almost a quarter, had all asynchronous requirements. And 4% had both asynchronous with mandatory and optional synchronous. So there was a spread. Students were getting very different experiences with requirements throughout their courses. Faculty learning and teaching online, we asked what devices they used. Most had a laptop. However, 3% did do all of their teaching on a tablet. Internet connectivity by faculty was reported as very good or excellent, and you're going to see a difference with this finding with the students. The top 3 educational technologies, again, from the faculty's perspective of what students thought was most effective: the learning management system, the live videos, and video recording. You'll see a difference there as well as students. Less than 10% of faculty use polling, quizzing, media resources, or OERs, open educational resources. Another interesting finding was prior to the pandemic, 15% of faculty were extremely comfortable teaching online, versus post-summer semester that increased to almost half of the sample, 42%. So at the end of our summer semester, 88% of the sample were now expressing feeling comfortable or extremely comfortable with online teaching. Workload and perceived support. I don't think this finding will surprise anyone listening to this presentation, but almost 60% of faculty indicated their workload for the summer semester increased by greater than 50%. And those of you that were in teaching the summer semester, I think you can relate to that increase. 27% increase, less than 50%. So, really we're looking at about 85% of faculty have an increased workload between 5 to 10 and 50%, and some over. With pedagogical support, we asked faculty their perception of the pedagogical, technological, and school support they received. For pedagogical, it was excellent to good. That's 55%, so over half, and very small percentage indicated pedagogical support was low. I know certainly for Dalhousie, having the drop-in centers with the online learning support was really, really good for a lot of immediate needs. The same as technological support, excellent and good, almost the entire sample. I think something telling here is that there were no faculty that indicated poor technological support. So certainly everything from being able to contact people to learn how to use different platforms, and how do we superimpose, just even using a PowerPoint presentation on Zoom, you have to change settings so that you can still see your Zoom settings. School support, on the other hand, did not show as great support. And the concerning statistic there was 20% of faculty indicated that the school support throughout the summer semester was perceived to be poor. Work-life balance, we asked faculty how they were managing work-life balances from 1 unable to 5 no problem. And again, I don't think this was anything the research team was surprised at. We were saddened to read about, but not surprised, that greater than 80% indicated they were unable or barely able to balance, with 15% having little or no problem. faculty perception of student experience, the effectiveness, and we talked a lot in the team about how do we ask this question. So we asked faculty to first of all define what effective teaching meant to them during the summer semester, and then we asked them the effectiveness. So we had about 40% of the sample indicated that they felt their teaching, the learning experience for students was effective or extremely effective, with a small percentage saying not effective. A student preference, so remember, this is the faculty perception of what they think students prefer. So the faculty indicated to us 4% that highly preferred synchronous sessions. 62% of faculty indicated that students will somewhat prefer them. Almost a quarter indicated that students preferred asynchronous. And about 2/3 reported that combination again of synchronous and asynchronous. Student engagement, and again to remind you that this is the faculty perception of what students were engaged in the most, or what was most effective. Faculty reported the top 3 engagement activities as virtual simulation, polling, and quizzing. The lowest engagement was with audio recordings. We asked faculty to rate their perception of the overall effectiveness based upon their own definition again, and Nadine will share kind of what the themes of teaching effectiveness were. Almost 60% reported a 4 or 5, feeling that the summer semester was overall effective from a teaching and learning perspective. It's a telling finding here as well was there were no faculty that indicated that their teaching effectiveness over the summer was not at all effective. Excuse me. Our student data, demographics, 40% were 20 years or younger, and another 40% between 20 and 30. We had 30% roughly residing in rural Nova Scotia. 5% of our students were outside of the province, and the remainder, just over 70%, were in HRM or CBRM. We did those distinctions so we could then see if there were more internet connectivity issues in metro areas or outside of metro areas. Almost 70% of students reported no dependents living with them. Our greatest sample representation came from semester or term 6, with the least from semester or term 4 and 8. Also, when I know going through the semester, having faculty meetings and talking about the workload that students were experiencing, we also wanted to ask about their actual work time or paid work time outside of school. Just over 60% did work throughout the summer semester. 15% worked full-time. I'm not sure how those students managed. 22% part-time and 24% casual. 41% of those that worked were in healthcare-related positions. Program of study, 34% were direct entry, 19% of those entering directly from high school, 28% were accelerated or advanced, and 7% were the LPN to BSCM program. So what did our students tell us? Half of the students had previously taken a fully online course. The device use was about the same. 2% of a tablet, a phone, and we immediately brought this to our respective schools. And I know at Dalhousie, we talked about it in executive, and our library has a laptop loaning service. So we very quickly pushed that message out to all our students that if they were if they were in need of a device to fully do their teaching and learning courses online, that they could apply, or not apply, just send a form to the library and request loan of a laptop. So that was a wonderful resource we found. And really based upon this 2%, I'm at the point now sitting in front of a computer is like, not again today. I can't imagine doing everything that we did online in the summer on a phone or a tablet. Internet connectivity, a stark difference here, somewhat or poor, 13%. And I think we were aware of that, certainly when we were doing some online synchronous work with students and the connectivity there. Comfort level, certainly summer semester increased comfort level. 14% of students reported being extremely comfortable prior to the pandemic. versus 20% post-summer semester. And we were surprised by this. We thought it would be higher. And I think some of the low comfort levels here were related to students having to learn so many different platforms. One of the things that we did immediately try to remedy for fall term is to try to stick to one type of platform. For example, video conferencing, they had to learn Team and Zooms and BB Collaborate. And, you know, there were so many different competing priorities in different courses. So it's important for consistency. Student engagement, about a third of the students reported being not at all or minimally engaged, and a third indicated somewhat or extremely. The median here was three, so less than half of our students reported being engaged in their courses, and that's somewhat concerning. Technology, the top 3 educational technologies that students reported being engaged in. Now remember, the faculty said virtual simulation, polling, and quizzing. The students are telling us their learning management system, quizzing, and live video. Live video once again goes into the need for synchronous requirements in courses that students expressed. Below the mean of 3, discussion boards, audio recordings, Collaborate, textbook, etc. 38% of students told us that the online technologies they did use supported their learning very good or excellent. Student preference, almost half preferred asynchronous learning. Over half preferred synchronous learning, and I think that's something, once again, for this fall, we've tried to do some synchronous within the courses, and we can look to have 1 or 2 synchronous sessions a week per semester cohort. Just, it's that commitment.
Is that same place?
So if we recall what faculty said, the faculty thought that students did not prefer the synchronous learning.
I'm turning up my speakers, I can't hear.
84% were we asked preference of learning, and we did put face-to-face in there, and this didn't surprise us. Our students want to be back on campus, as well as our faculty. Course outcomes, this was reassuring. 92% of our students reported meeting course outcomes, with 7% reporting they did not meet course outcomes. 28% indicated the summer semester was effective, and 33% were neutral to this question, either effective or ineffective. There was a large percentage that reported the semester is not effective from learning, and I think once Nadine gets into some of the themes that arose from the data, these statistics will make a bit more sense. Mental health and support, 41% indicated very good or excellent accessibility to peer support. However, almost a third had fair or poor access. So this is something that we're going to have to really pay attention to when we come offline, as well as we continue online. Students reported they received the most support from their schools related to COVID-19 information, and they felt the least support was related to their health and well-being, as well as study supports, and those means are quite low. Just to give a quick example of, and then I'll turn it over to the interesting qualitative data to Nadine. If we look at the bottom 2 rows, there's student health and well-being resources. You know, most of the students reported below the average of 3. Only 14 reported excellent support, the same as study support. So those are a couple of areas we really need to pay attention on. So now I will turn it over to Nadine for the qualitative data, and you can just prompt me, Nadine, when you'd like me to switch the slides.
Thank you, Shelley. So first I want to say that qualitative data, basically we had a few questions at the end of the surveys, open-ended questions, and the students and faculty both answered these questions, and we did a thematic analysis on these answers. In our work as a team, we have met frequently, and we agreed on the themes, sub-themes also, but the questions were divided. So the quotes I have in this presentation were heavily from the section I was analyzing, whereas we're all in agreement on the themes. So the questions that were asked in the student surveys were, how would you define effective learning in the spring summer session, which was basically the question I worked on. How did missing clinical practice component impact your learning? Top 3 challenges, issues encountered in the spring and summer semester, and recommendations or additional thoughts. Those for the faculty were how would you define effective teaching? Top 3 challenges for your students were, and top 3 challenges that you as faculty encountered, opportunities for future online learning and teaching are, and the recommendations. So again, to emphasize that the quotes were basically from the questions, how would you define effective learning and for students, and how would you define effective teaching for faculty? Next, yes, thank you, Shelley. So we had mainly 3 overarching themes that we had, which were basically learning and teaching, relationships, and mental health. Not surprisingly, they resonate very well with the qualitative data that we had. So when it comes to learning and teaching, we had several sub-themes. Just to confirm some of the findings that we had in the quantitative is that students, they denied effectiveness of virtual learning. They wanted face-to-face. So one quote by students says that effective learning for me requires face-to-face interaction, and nothing virtual was effective. Some students actually, they liked this online environment because it kind of created a better fit for their personal life and their familial obligations. One student said, online made my experience less stressful as a single mother because I was able to be home with my daughter when school was closed due to COVID. And that's very interesting because we know in our advanced entry, we have a huge cohort who have families and children. Other students, so when it comes to the synchronous versus asynchronous, and as you recall from the quantitative data, faculty did not see as synchronous as a preferred method for students, but students, obviously, they like the synchronous sessions. So for them, effective learning would be synchronous lectures that are engaging and capture our attention, which was hard to achieve in the asynchronous mode. When it comes to recorded lectures, because we relied heavily on recorded lectures, students, so when lectures were given synchronously and not recorded, that really put some students at a disadvantage. So this is a student who said, I worked full days, 7A, 5P, and was not able to watch the lecture live. It was difficult to stay up to date and was very out of the loop for class discussions. And that's something we always have, even now that we're moving for some synchronous times. Students always ask if we'll be recording these synchronous sessions. And to be transparent also, that us as faculty, we always think that we're kind of hesitant to record synchronous sessions because then students would not attend. So it's a challenge. But generally students like recorded lectures because it gives them the opportunity to revisit frequently at their own pace, at their own time. So one student said being able to access information after a lecture, for example, in one class, a professor would record themselves giving the lesson with the slideshow simultaneously, which could be studied on my own time at my own pace. Nevertheless, the time allocated with recording lectures, and we struggle with this, is the long duration of the lectures has shown to be challenging for students. Sitting down to watch 10 to 20 hours of video a week was not helpful to me. I am a fairly good student. I did learn things, but how much I retained overall, I cannot say. And this is something we still face with our students, that there's a lot of content that's recorded, and there's a long time that students are listening and watching these lectures. Home setting and technology as environment for learning and teaching. Home was described by some students as not being the most perfect environment because it involves distraction. So effective learning for them would include not being distracted at home. Technology was challenging as for some, as quantitative data showed and Shelley told us. So recorded sessions was helpful because the internet did not always work well during the lifetime of class. So that's another code that really talks about recording desynchronous lectures. And another code that talks about challenging technology, though lectures were recorded, sometimes they were not made available to view or had issues downloading the recordings. So there were always glitches when it came to having the lectures. Student engagement and active learning was also very prominent. The quantitative data showed that students did not feel themselves as engaged, though the topic itself of being engaged was emphasized both by faculty and students. One student said effective learning included any learning that allowed or encouraged the students to be engaged, like the live chat rooms. And also the faculty said that high level, they describe effective teaching would be a high level of engagement of students with course professors, peers, and course resources. Tutorials were identified as one of the venues that were available during the summer, spring that allowed for this engagement and active learning. And it was basically, it was appreciated by both students and faculty. So for faculty, they described effective teaching as tutorial attendance, which was mandatory, and student engagement within the smaller tutorial group for completion of case studies. And the students said that tutorials are where I found I was learning most effectively. And I just want to comment that tutorials, yes, we're still hearing from students during the fall and during the winter that tutorials are very effective for them, yet very little time is really allocated for tutorials. Clarity of material and platform. The concept itself was emphasized by both faculty and students. So for faculty, for them, effective teaching is when students are able to access learning resources and supports, but students had difficulty accessing these resources and really navigating these platforms. So one student said that they had to search multiple platforms to find the answers for some topic they were looking for. And they wanted more information. So another student said effective learning is not just being told about the resources, but being told how to access these resources, which tell us that students had a hard time navigating the courses, the course shell, and the course load was also, it was something that was identified in the quantitative data. And again, in the qualitative, so effective learning would have been if we had a manageable course load. I found it insane, the amount of extra work and projects that occurred due to the switch to online. Next slide. So this is a good entry to the second slide, which basically talked about the evaluation. So the evaluation elements, were they overwhelming, or was it a lack of organizational skills of the students? And that's interesting because now we start to see how faculty and students see things differently. So students found the number and frequency of assignments as overwhelming. And with that number of assignments, it impacted their learning. So many assignments due. There was no time to absorb the information being discussed. It was fast-paced to the point of not being able to digest the information, but rather just stay busy doing assignments and papers for 6 weeks. Faculty, on the other hand, they still expected students to submit their assignments on time. So for the faculty, one faculty said, effective teaching will be students reviewing the recorded lectures and submitting assignments on time with evidence of a new learning. Sorry. Kyle, which is at the faculty, when they kind of, so in an answer for the students' hardship and load that they felt. That's a quote by one faculty who said, students were engaged. They showed up, they participated, and were able to meet their course requirements and objectives for the most part. Some struggled more than others to keep up, especially with all of the reading and online learning works differently for different people. So here, it's like, what I'm trying to say here is that we're trying to portray actually is that faculty considered the inability of the students to stay on top of their requirements and finishing the assignment and course reading as a specific challenge, specific organizational skills that some students had, whereas we saw from the quantitative data that students really considered, that a huge number considered that the workload was a huge. That's something I personally found very interesting when it came to the description of learning and teaching effectiveness. So is it long-term goals we're looking at to describe learning as effective, or is it passing the course, which is a short-term that is considered effective? Students, they did not associate effective learning with grades. One student said, effective learning where I felt confident that I know the material. I did get good marks in the courses. However, I do not feel as though I know the material as well as I would like to. And these students, when they try to describe effective learning, so they associated effective learning as with long-term impact, long-term goals, when they are able to apply that knowledge in future clinical settings. So one student said, effective learning is how I feel once I enter back into practice setting to know if the learning that took place in our spring and summer semester was effective or not. And when I could see where and how they were relevant to my nursing career. Faculty, on the other hand, and it's interesting that none of the answers by the faculty mentioned the long-term goals, and they were mostly around meeting the course outcomes and passing grades. And some faculty with very specific, like effective teaching for them is student engagement, as in questions, positive feedback related to course delivery, and final grades on a bell curve with a B+ average. Next, please. Appropriateness of evaluation methods were brought up. There's by faculty actually, and also by students. Faculty recommended more innovative methods of evaluation than the online exams. Sorry. And there was an emphasis on this feedback, the regular feedback that students can receive, which was not very prominent. I don't want to say it was missing, but because courses were heavily asynchronous, so giving regular feedback was not possible, except probably in tutorial sessions, which were face-to-face. So to get reassurance of where you were on the to get reassurance if you were on the right track. That was one quote by the students. And another student said, it's very difficult to know if you are actually understanding what you are supposed to be learning, because they were not getting any feedback. Relationships, basically communication was prominent on the relationship, the need for clear communication. And we're talking here about communication when we're answering questions, when we are talking like faculty and students talking together, because the concept of clarity of content and clarity of platforms was addressed in the learning and teaching theme. So relationship as a second theme now talks about effective communication between faculty and student was emphasized by both faculty and students. It wasn't always successful. Student talked, and when they described effective learning for them, it was open communication through appropriate means from course instructors that are timely and clear. Another student expressed frustration because there wasn't clear instructions. We were sent out on the front lines to work in high pressure society with serious health risks for students, while made to complete a ridiculous amount of work and had no instructions until the very end of the course. One student actually was happy because they thought that they achieved with this platform some personal approach to communication with faculty, and I found that interesting. Faculty member emphasized the importance of communication. Effective teaching for them is being able to communicate concepts in a way that students understand the concept knowledge, so students correctly problem solve while attempting to apply the knowledge. So the ability to clearly communicate concepts and clearly communicate ideas to students was crucial for higher levels of skills that we need from our students, which is problem solving. Support. These were stressful times. Did students and faculty support one another? Faculty communicated that it's important to support the students. So effective teaching for them was supporting students in their learning, creating a community of learning, and encouraging students to learn with and from each other. Sadly, students did not feel that they were supported, and the quantitative data that Shelley shared also confirmed that. So one student said, and I thought these are powerful quotes, having faculty actually listen to why online learning is challenging instead of constantly comparing our situation to theirs. Another student, they talked about a lack of compassion and support from faculty. One student said, while we were out on the front lines, our professors were sitting comfortable at home, judging us and coming up with ways to make things harder for the student body, rather than ask what we felt we needed help with and make this semester more manageable. And again, parallel to what Shelley in the quantitative data said, that the faculty did not feel that the school was supportive. One student said it felt more like the school and program were worried more about liability, their own reputation, than about their students' learning and well-being. I think these are powerful quotes, but these are serious. We know that it was very stressful. Lots of students struggled a lot with lack of support. The whole online was challenging, and as much as I know that lots of faculty tried to provide support, but obviously there are students who were not able to reach to. And motivation was described as a very crucial element to maintain mental health. Both faculty and students talked about the importance of motivation, which is something that wasn't always sustained. Staying motivated to complete the courses, not being distracted, and for faculty, motivation is students verbalizing their enthusiasm and regarding their learning, and that there are mental and social support for them. I think this brings it to the end of our qualitative data. There were a couple of teams still have work to do. Analysis is not complete yet. So there were a couple of sub-themes that kind of showed up in the quotes of the other questions, and we thought that they were kind of interesting. Academic shock and the waiting game. So transition to online, capacity building related to multiple online platforms, dealing with technology, internet issues, developing resilience, gratitude, optimism, and hope, and managing stress, understanding. These were all elements that that students were kind of shocked with with this transition to the online. And the waiting game was very high with the questions related to the clinical practice, because there were a lot of uncertainty. If they were going to complete the clinical practice, when they are going to join, when they, and some were pulled, where to live, if they were graduating or not, how the whole rituals, ceremonies are going to happen. And there were a lot of unknown and fear of pandemic that we were on the waiting game. We are still on the waiting game, I would say. I don't know how I did for this last slide.
No, that was great, Nadine. As I said when we started, we're not quite done the qualitative. But when I look at this picture of academic shock, I remember feeling that about the third week of March, just feeling like my eyes wide and open. And so it'll be interesting to continue on, and we would love to share the rest of the qualitative once we get it done. And thank you both, Julie and Megan, for arranging and inviting us to the session. And we're more than happy to take questions.
Yeah, exciting research. So I'm just going to open it up to the audience to see comments and questions. Yeah, I know that Leah had a question earlier in the chat. I don't know if that was answered or not, but, and if people would like to type things into the chat bar, then that would be great too.
Sure. We didn't define school support. We let students and faculty. So we asked the question, on a scale of 1 to 5, how well did you feel supported by your school? And then we broke it down, also to ask for support for technology, as well as pedagogical supports.
When you created your research and all of the questions, assuming that it was to focus on the online in COVID, would you be able to do this again, like later, just to see differences between online and offline? I know you haven't quite finished this one yet, but you're pretty well near the end, but could you see it, using it again?
Well, I think we probably could, Megan. I guess the number one question is, when are we going to get back on campus? We may run this again just to gather the experiences and see how we're doing. But I think what this has done for us, I know within Dalhousie, we have some work to do. But this gives us some tangible information to start doing some of that work. I know the university has recently put a standardized Brightspace template online. If you recall, nursing years ago did that. We had our courses standardized, so a student could go into any undergraduate nursing course and know exactly where everything was. And we got away from that. And I think it was creativity and doing new things. And so the Center for Learning and Teaching have created that they've put out in hopes that the university will use it. So students, even in different schools and departments, can find things easier. And that was where students said they're exhausted learning the technology before they even get to what they're supposed to learn in nursing on the technology.
Yeah, it's really compounded. I mean, some of the statements that were coming forth from students and faculty, I had heard those even face to face, like the assignments, etc. But yeah, how do you pull that out? And this was all online, and it just compounds it so much. So yeah, it's really interesting to see all of the. Sometimes.
What do you think, Nadine? Do you think we can run this again when we get back face to face?
We can run. I think the whole something should be tweaked. Like we have been hearing all through, and that's something we really give ourselves credit that there has been a momentum with the forums with the student, and we knew some of this. Like as Shelley said, several items were not a surprise, and we've been working on it. I think like synchronous and asynchronous, what should synchronous be composed of is something we have had discussions, and faculty are trying differently. So at one time, changing a little bit the questions to figure out what have been done and what was effective of what have been done, rather than exactly repeating the same questions. So I think synchronous and asynchronous sessions has been a hot topic. Evaluations were a hot topic in the fall. I know we had lots of questions. I know in my courses, several of them, we have kind of, I don't want to say revamp, but we really did a lot of work with the tutorials being hybrid, like both synchronous and asynchronous. So yeah, different.
And that's right. I think what's intersecting right now globally in post-secondary and P to K-12 education is the well-known and well-researched best online practices do not fit when an entire program is online. So for example, a good pedagogical online practice is weekly engagement. Keep students interested and onto the site. If we do that in 5 courses, we now understand the student that says, I have no time to study or apply because I'm writing all these papers and I'm doing all these requirements. So it's to balance what the research was done. That environment was looking at online courses, not an online program, especially a practice profession. So I think we have to start creating some new research that looks at, when an entire program is online, what are those best practices and how can we achieve that balance of engagement, synchronous, asynchronous, and try to continue with the high standards. I see Andrea.
Mm-hmm.
Hi, thanks. Thanks for the research. It's amazing, and I'm glad to hear some of the results. So I have a couple of questions. One is, and I'm sure you're one of the first ones, and you might be the only one so far, because I guess I suppose you're working on a publication, so it's still early. But do you know of any other similar studies that have been done, and if we can draw some comparisons? So that's my first question, if there are any similar studies out there. The second question, though, I think is more important in terms of what's the next step now. So I suppose you will come up with some recommendations, some action items, and I'm wondering in how far we can actually involve the students, the student body in formulating the action items, and if they're, I'm not sure if there's a forum perhaps planned where we can have a dialogue between the decision makers in the various places and see how we negotiate a way forward. Because I'm sure we will probably not go back to exactly what we had before, and we might continue teaching and learning in a hybrid model. So I think there are lots of lessons to be learned from this. So I guess the question again is, how do you see formulating those recommendations, who will be involved, and some of those plans? That's my question. Thanks.
Yeah, that was mine as well.
Okay, well, thank you, Andrea and Danielle. And I guess the simple answer is we're not sure yet. We're still formulating. What we did decide just before Christmas, hence we're able to present today, is that we would push this data out immediately to our faculty. So it informs program planning, but I think that's a great idea to have an open student forum, and really similar to what we do in our program with the CSI evaluation, and say to students, this is what we heard you tell us. This is what we're proposing will help your learning. Is that what you think would be beneficial? That may be a wonderful process to do within the school.
If I may say, there was, in one of our meetings, there was a discussion about the recommendations, and I love this term, and I keep saying it in all my meetings, humanizing the online teaching, the online engagement. And actually I'm carrying this along. So I sit on the undergraduate student affair committees. And that was a discussion that we started of how we're gonna support our students, because mental health was very prominent in this study and was very prominent for us as faculty teaching. And what was suggested, we started, as I said before, the holidays in December, and this Monday we had the second meeting. So the idea is really creating a task force that communicates with the students, and the idea is that it's going to be led by students, to listen to them, how we can support them, how we can reach for those students who do not speak, who do not come for faculty for support. What venues do we have? There was an idea by Beth to have an allocated role in the student committees, who is a liaison between the faculty and the student that kind of gets all that data and present it to the faculty to figure out how best to support them. So what I'm trying to say is that, yes, there is something being thought of at the level of that committee, and it will be basically student-led in that regard.
That's wonderful, Nadine. Just to answer Andrea's other question about other studies, we found nothing, and I think it's just starting. We're starting to see some things come out now. What I'm excited for a comparison is to get Dalhousie's tech survey research. So they did a university-wide study. So when that data comes out, it'll be interesting to see how the provincial nursing student data compares to the Dalhousie data across all faculties and schools. But I suspect within the next few months, we'll start seeing some research. Certainly there's a lot of student stories and commentaries about teaching online on there. But once again, I think we've relied on tried and true good online pedagogical principles that are no longer faring well for our students or ourselves with a complete immersion in online.
I had a question. I'm not sure about the etiquette on raising hands on Zoom meetings, if that's okay. Okay, great. Thank you.
Alison had her hand up for some time before you showed on the screen, Erica.
Okay, no problem.
So let's go Allison, Erica, and Leah. Okay.
Okay, sorry. Yeah, it doesn't matter to me. I didn't know what we were doing either. I guess for some context, I'm in semester 4 of the advanced standing program at Dal, and yeah, certainly a lot of those student comments resonated with me and the general feeling of being very overwhelmed. But I guess what stands out to me is I'm curious how these, or what the results would be for students that had started the program in person and then are now doing it online, versus I started in semester 3 last fall, and so I've only experienced this program online. So how much of these issues have been exacerbated by being online versus just general program issues, I guess. Like, what are the feelings of students through the program when they are starting in person, and are these common feelings regardless of the platforms and format of the courses?
That's a great question, Allison. And luckily, we're going to be able to dissect our data and see if there are differences between students who started fully online and those who started in face-to-face and then moved online. So we do still have some work to do. thanks though for attending and giving your perspective.
I think Erica and then Leah.
Thanks. Yeah, I'm also in semester 4, so it was cool to see everyone's different feedback on this presentation. So thank you for having me on this. I guess my question is kind of, my main takeaway from this is that there's a gap between the student perceptions and the faculty perceptions, and with the online change. So I was curious if there was any research from before COVID that you all looked at, where you were looking to see if those gaps between student perceptions and faculty perceptions were still there. Because that's my main takeaway, is that students and faculty aren't on the same page as to what they think is happening and happening well. So I wasn't sure if that was looked at all in just other literature to compare.
Maybe Nadine, you can, I certainly haven't, Erica. It was, I call it fast and furious is what happened. And we wanted to capture it. So we did a very speedy literature review to see what was out there, and there wasn't a lot, but I would suspect that there are differences between faculty and student perceptions, whether we're totally online or face-to-face. And I think the key for School of Nursing is to figure out how best to bridge that gap. You know, it's similar to the practice to theory gap that we have bridged, and now it's to bridge that gap. Nadine, do you want to add to that?
I want to say that it's not that there's this a huge gap or there's a gap in everything. Like, there are certain points they both agree on. I think the most, the support was probably so obvious that students did not feel supported. And faculty, they did acknowledge that they want to support the students, but the challenge is that, and as we all say, we're not really sure how we can support the students. I mean, you hear me in class, let me know how you learn, let me know what you need so that I can offer this. I mean, like, we're behind the screens. We have no idea what's happening with every student, be it in class or be it outside. I think what I found most interesting is the discrepancy of what effective learning or teaching is between the long-term goal and the short-term goal. And I would expect that probably the advanced entry come with, now I'm assuming, right, they have this vision, like what's in this, like I'm learning now, how much benefit is this gonna give me, how I'm gonna apply it, because they come with a goal in mind, like they know where they're heading. Direct entry, they are so overwhelmed, there are so many details that probably think that they go through the momentum of just passing the course. So I haven't looked into literature as such. There are always differences, like even between students themselves, there will be differences. Yeah.
Yeah, I think that's why I was just interested by it. Like, there's always going to be differences. So are these differences that you were able to find between faculty and students really that shocking? Like, would they still exist in normal, non-COVID related? I feel like there would still be that difference in the gaps in some of those areas, like you mentioned.
Definitely, I would say. I've always thought of differences as developing, because you will face the same thing in clinical. Some health professionals have specific goals. They work in a certain way that might be different than the way you see things, and it's really adapting and us really doing our best for the safety of our patients. That's what counts. Adaptation is the key. I mean, I acknowledge we as faculty come from all different schools and philosophies of teaching. Some believe in didactic teaching, like giving lectures. Others are more into active learning, and these all are there, right? These are like, there's literature that supports all these methods. So, but it's for the student to really figure out how they learn best and figure out how to really bridge that gap between how they learn and what the faculty is presenting as a teaching methods. I'm not sure if I'm really making sense here.
No, that definitely makes sense. Thank you.
I think the key and a goal for the school, though, is to minimize these perceptual differences to enhance student learning. I think that is the goal. And I know, Megan, it's
yeah, it's 1 o'clock, but just 2 more. I'm going to suggest that we extend it for 5 minutes or 4 more minutes. Olivia did suggest to think about accessibility, and I want Leah to jump in with her comment question.
Sorry, I really have to go because I'm in the lab and my students are waiting.
Okay.
So I'm
Can you hang in there, Shelley?
Thank you.
Okay, thanks, Nadine.
Bye.
Sorry, I'll be quick. I know we're over. I know there have been a lot of conversations about EDI in the school right now, so I'm just curious if you incorporated any like demographics into your analysis. Like, were there any differences from students from priority communities in terms of their learning gaps in COVID? Thanks.
No, Leah, we did not collect that data. We limited our demographic data to exactly what we could use, and unfortunately that got missed, and that would have been an extremely important aspect to collect data on, but we did miss a couple of things. And to be perfectly honest, I'm going to say it was about 72 hours we had to create a proposal, submit it for ethical funding or for ethical approval. So it was a quick, very quick. We wanted to get it out of the gate and get it to students as they were experiencing the online learning. So we have missed some key demographic information that we should have collected.
If you ever do any follow-up related to that, I'd love to be looped in. Thanks.
Awesome. That's great. Olivia, I don't know if you're still here. Just looking at the names. Yeah, anyways, accessibility was an issue that Olivia had suggested. Great. Any final words, Shelley? Oh, can't hear you.
It's that whole new sign language we're learning, right? Turn it up, down. But no, just a big thanks again to Megan and Julie for inviting us, and to everybody who joined in. And let's keep the conversation going. I'd love to throw 3 takeaways out. The importance of our learning management system cannot be overstressed enough. Students like quizzing, they like consistency, so let's get consistent. Synchronous sessions, let's offer those to our students, being mindful of not disadvantaging the students that either work or have children. And let's drop that guard and get comfortable recording those sessions. And let's really focus on mental health and study supports.
Well, thank you so much to you and to Nadine. And I would say this is a beginning conversation, and our audience has raised quite a number of excellent questions and suggestions for moving forward. And I think having an open forum would be wonderful. So thank you so much. Thank you.
You're welcome.
Okay.
Our pleasure.
Great. Well, we'll see everybody soon, I hope.
Bye.
Okay. Bye-bye.